Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on personality disorder. So let us discuss what it is. As you know that personality disorders are conditions in which an individual differs significantly from an average person in terms of how they think, perceive, feel or relate to others. Changes in how a person feels and distorted beliefs about other people can lead to odd behavior, which can be distressing and may upset others. Common features include being overwhelmed by negative feelings such as distress, anxiety, worthlessness, or anger, avoiding other people and feeling empty and emotionally disconnected, difficulty managing negative feelings without self-harming, for example, abusing drugs or alcohol or taking overdoses or in rare cases, threatening other people. And sometimes they behave in odd behaviors and sometimes difficulty in maintaining stable and close relationships, especially with partners, children and professional carers. Sometimes periods of losing contact with reality. Symptoms typically get worse with stress. People with personality disorder often experience other mental health problems, especially depression and substance abuse. When and why personality disorder occurs? Personality disorders typically emerge in adolescence and continue into adulthood. They may be mild, moderate, or severe, and many people have periods of remission when they function well. Personality disorders may be associated with genetic and family factors. Experiences of distress or fear during childhood, such as neglect or abuse, are common. Now we would come to the type of personality disorders. Several different types of personality disorders are recognized. They have been broadly grouped into one of three clusters: A, B, or C. Now, cluster A personality disorder. A person with a cluster A personality disorder tends to have difficulty relating to others and usually show patterns of behavior most people would regard as odd and eccentric, and others may describe them as living in a fantasy world of their own. An example is a paranoid personality disorder, where the person is extremely distrustful and suspicious. Then, cluster B personality disorders. A person with a cluster B personality disorders struggles to regulate their feelings and often swings between positive and negative views of others. This can lead to patterns of behavior others describe as dramatic, unpredictable, and disturbing. An example is borderline personality disorder, where the person is emotionally unstable, has impulses to self harm, and has intense and unstable relationships with others. Then we have the cluster C personality disorders. A person with the cluster C personality disorder struggles with persistent and overwhelming feelings of fear and anxiety. They may show patterns of behavior most people would regard as antisocial and withdrawn. An example is avoidant personality disorder, where the person appears painfully shy, socially inhibited, feels inadequate, and is extremely sensitive to rejection. The person may want to be close to others but lack confidence to form a close relationship. How many people are affected? Personality disorders are common mental health problems. In England, it is estimated that around 1 in 20 people has a personality disorder. However, many people have only mild conditions, so only need help at times of stress, such as bereavement. Other people with more severe problems may need specialist help for longer periods. What is the outlook for the personality disorders? Many people recover from personality disorders over time. Psychological or medical treatment is sometimes helpful and sometimes support is all that is needed, and this depends on the severity of the disorder and whether there are ongoing problems. Some mild to moderate personality disorders improve with psychotherapy. Different types of psychological therapies have been shown to help people with personality disorders. However, there is no single approach that suits everyone, and treatment should be tailored to the individual needs. Not all talking therapies are effective, and it is essential they are delivered by trained therapists. What are the signs and symptoms of personality disorder? The different types of personality disorder that might need treatment can be broadly grouped into one of the three clusters called A, B, or C. Cluster A personality disorder tends to have difficulty relating to others and usually show patterns of behavior most people would regard as odd and eccentric, and the main personality disorder in this category are it is paranoid personality disorder. A person with a paranoid personality disorder is extremely distrustful and suspicious. Other features include thinking other people are lying to them or trying to manipulate them, feeling they cannot really trust their friends or associates, worrying that any confidential information shared with others will be used against them, and thinking there are hidden meanings in remarks most would regard as innocence, and worrying that their spouse or partner is unfaithful despite a lack of evidence. Then is the schizoid personality disorder. Someone who is schizoid personality disorder may appear cold and detached and avoid making close social contact with others. Other features include preferring to take part in activities that do not require interaction with others, having little desire to form close relationships, having little desire to form close relationships, including sexual relationships, being uninterested when receiving criticism or praise, and having a limited ability to experience pleasure or joy. Then is the schizotypal personality disorder. A person with schizotypal personality disorder is likely to have poor social skills and delusional thoughts and behave in unusual ways. Other features include attaching undue and misguided significance to everyday events, such as thinking newspaper headlines are secret messages to them, and believing in special powers such as telepathy or the ability to influence other people's emotions and actions, having unusual ways of speaking such as long, rambling, vague sentences, or going off on a tangent, and then experiencing excessive anxiety in social situations, even if they have known a particular person or group of people a long time. Then cluster B personality disorder. Someone with a cluster B personality disorder struggles to relate to others. As a result, they show patterns of behavior most would regard as dramatic, erratic, and threatening or disturbing. The main personality disorder in this category, such as antisocial personality disorder. A person with an antisocial personality disorder sees other people as vulnerable and may intimidate or bullying others without remorse. They lack concerns about the consequences of their actions. Some symptoms include such as lack of concern, regret, or remorse about other people's distress, irresponsibility and disregard for normal social behavior, difficulty in sustaining long-term relationships, little ability to tolerate frustration and to control their anger, lack of guilt or not learning from their mistakes, blaming others for problems in their lives. The National Institute for Health and Care Excellence (NICE) has published guidelines on how people with antisocial personality disorders should be treated. So now you would come to the borderline personality disorder. A person with a borderline personality disorder is emotionally unstable, has impulses to self-harm, and has very intense and unstable relationships with others. Histrionic personality disorder, the person with histrionic personality disorder is anxious about being ignored. As a result, they feel a compulsion, overwhelming urge to be noticed and the center of everyone's attention. Features include displaying excessive emotions, yet appearing to lack real emotional sincerity, dressing actively and engaging in inappropriate flirting or sexually seductive behavior, moving quickly from one emotional state to another, and being self-centered and caring little about other people. constantly seeking reassurance and approval from other people. Symptoms and signs may coexist with borderline and narcissistic personality disorder. Narcissistic personality disorder, a person with narcissistic personality disorder swings between seeing themselves as special and fearing they are worthless. They may act as if they have an inflated sense of their own importance and shown an intense need for other people to look up to them. Other symptoms include exaggerating their own achievements and abilities, thinking they are entitled to be treated better than other people, exploiting other people for their own personal gain, lacking empathy for other people's weaknesses, looking down on people they feel are beneath them, while feeling deeply envious of people they see as being above them. Then cluster C personality disorder. Someone with cluster C personality disorder fears personal relationships and shows patterns of anxious and fearful behavior around other people, and others may be withdrawn and reluctant to socialize. The main personality disorders in this category are avoidant personality disorder. A person with avoidant personality disorder appears painfully shy, socially inadequate, is inadequate, and is extremely sensitive to rejection. Unlike people with schizoid personality disorder, they desire close relationships with others but lack the confidence and ability to form them. Then dependent personality disorders, a person with dependent personality disorder feels they have an ability to be independent. They may show an excessive need for others to look after them and are clingy. Other features include finding it difficult to make decisions without other people's guidance, needing others to take responsibility over what should be their own important life choices, not being able to express disagreement with other people, finding it difficult to start new activities due to a lack of confidence, and going to extremes to obtain support and comfort, feeling helpless and uncomfortable when alone, urgently needing to start a new relationship once a previous relationship comes to an end, having an unrealistic and constant fear they will be left alone to fend for themselves. Then is the obsessive compulsive personality disorder. A person with obsessive compulsive personality disorder is anxious about issues that seem out of control or messy. They are preoccupied with orderliness and ways to control their environment and may come across to others as a control freak. Other features include having an excessive interest in list timetables and rules, being so concerned with completing a task perfectly that they have problems completing it, and it means they have liking of perfectionism and being a workaholic, having very rigid views about issues such as morality, ethics, and how a person should behave in daily life, hoarding items that seems to have no monetary or sentimental values, being unable to delegate tasks to other people, disliking spending money as they think it will always be better to save for a rainy day. This personality disorder differs from obsessive compulsive disorder OCD, a related mental health condition, in several important ways. People with OCD are aware that their behavior is abnormal and are anxious about it. Most people with obsessive compulsive personality disorder think their behavior is perfectly acceptable and have no desire to change it. Some people with OCDs are compelled to carry out rituals such as having to touch every second lamppost as they walk down the street. This is not usually the case with people with obsessive compulsive personality disorder. People with OCDs may feel compelled to make lists or organize items in their house but feels anxious about doing so. People with obsessive compulsive personality disorder find relief from anxiety when doing such tasks and may become irritated. And when prevented from doing so, treatment for most personality disorder usually involves the course of psychological therapy. This normally lasts at least 6 months, often longer depending on the severity of the condition and other coexisting problems. Then psychological therapies. Psychotherapy is a treatment that involves discussion of thoughts, emotions and behaviors with a trained professional. The aim of all psychological therapies is to improve people's ability to regulate their thoughts and emotions. Then some therapies focus on dysfunctional thoughts while others focus on self-reflection and being aware of how your own mind works. Some therapies, especially group therapies, help people understand social relationships better. Then psychological therapies can be effective for many personality disorders. However, they should only be delivered by a trained professional who has experience of working with personality disorders and other clinical conditions. This is because personality disorders are serious conditions that can be associated with high-risk behaviors such as self-harm, as well as listening and discussing important issues with you. The psychotherapist can suggest strategies to resolve problems and, if necessary, can help you to change your attitudes and behavior. A range of different psychotherapies are used to treat personality disorders, and they can be broadly classified into three types of therapy outlined, such as psychodynamic reflective psychotherapy. Psychodynamic psychotherapy is based on the idea that many adults' pattern of behavior are related to negative early childhood experiences, and these experiences cause patterns of distorted thinking and beliefs that may have been understandable in childhood but do not work in adult life. The goal of therapy is to explore these distortions and understand how they arouse and find effective ways to overcome their influence on your thinking and behavior. Both individual and group psychodynamic therapy may be helpful for personality disorder, especially borderline personality disorder, BPD. A particular form called mentalization based therapy is recommended for BPD. Then cognitive behavioral therapy is based on the theory that how we think about a situation affects how we act. In turn, our actions can affect how we think and feel. Therefore, it is necessary to change both the act of thinking, cognition, and behavior at the same time. It's a type of CBT called dialectical behavior therapy. DBT has proved successful in helping people reduce impulsive self-harming behaviors, especially in BPD. BPD is designed to help you cope better with emotional instability while at the same time encouraging you to behave in a more positive way. Interpersonal therapy, IPT, is based on the theory that our relationships with our people and the outside world in the journal have a powerful effect on our mental health. Several personality disorders may be associated with feelings of low self-esteem, anxiety, and self-doubt caused by problems interacting with people. During IPT, the therapist will explore any negative issues associated with your interpersonal relationships and how these issues can be removed. Then therapeutic communities. Therapeutic communities or TCs are a group of forms of therapy in which the experience of having a personality disorder is explored in depth. The TCs are an intensive form of therapy. The minimum type of TC is 1 day a week, but others are 9 a.m. to 5 p.m. 5 days a week. They have been shown to be effective for mild to moderate personality disorders, but require a high level of commitment. Then medication. No medication is currently licensed for the treatment of any personality disorder. However, medications may be prescribed to treat associated problems such as depression, anxiety, or psychotic symptoms. For example, if you have moderate to severe symptoms of depression that make it feel to approach your therapy with confidence or enthusiasm, you may be prescribed a type of antidepressant called a selective serotonin reuptake inhibitor SSRI. Some people, especially those with BPD, have found mood stabilizing medications helpful. If you have liked this video, then kindly share with other individuals as well, and don't forget to subscribe my channel, and have a wonderful nice day. Thank you for listening this video, and thank you very much.